I'm really excited for this 1 hour that we're going to spend together. There's quite a lot to go over. I'm really hoping that you'll get as much as possible from this session so that you can better prepare. So let's make a start. For those who don't know me, my name is Dr. Erwin Kwun. I'm a portfolio GP. I'm on a mission to help doctors lead a fulfilling life. During my career, I've been really interested in positive psychology. In medicine, we usually focus on what's not working, on pathologies. Was I read about this positive psychology research, and I was fascinated by positive psychology, where the way that this field has developed is not looking at what doesn't work, but looking at what is working in someone and how to play to their strength so that they can achieve fulfillment. So that's why I was interested in positive psychology, and also have developed some coaching psychology skills as well. Coaching psychology is something that I benefited personally, and this is something that I've introduced in medical education, and I've been helping GP trainees throughout their MRCGP exams and also CCT and beyond. Over the last couple of years, I've helped over 178 GP trainees. Just to give you a bit of background, I passed the RCA back in December 2020, and I CCT'd in 21. Some of you might know that I've got a YouTube channel. It's a YouTube channel where you have resources about GP training and also consultation. One of the interviews that I would highly recommend you watch is the one with Dr. Roger. So the channel's been really useful for trainees. If you have not to watch the videos, have a look at it. It's Dr. Erwin Kwun. Question for you guys. What makes a successful consultation? Some of you are saying all of them, problem solving, to choose one. When we think about learning consultation, it is very overwhelming because there's so many models out there and everyone is consulting differently. If we strip it to its basic, a consultation is where somebody comes to you with a problem and you identify which problem that you're going to solve, and you turn that problem into a plan for that person. Essentially, that's what it is. And to be able to do that, you need to have the right attitude. You also need to be able to develop the right communication and consultation skills to achieve these tasks in the consultation. And also there is the way that you're consulting as well, how you're consulting, how you make the patient feel. So person-centered approach is really important. It can be difficult, especially for doctors who have been trained overseas, where the person-centered approach is not the way of practice where they were taught, and they're having to change that. So it can take a while to adapt to that approach. Today, you're going to learn about the introduction of the MRCGP SCA. We'll also go over the challenges and pitfalls, how to prepare and how to pass your exam. The simulated consultation assessment is a new assessment that started in November, and it is taken in your ST3 year or later. You usually have to take it in your own surgery, or it could be taken in a local GP surgery. So what is the SCA? The SCA is a licensing exam that consists of 12 simulated consultation. You'll have 12 minutes per consultation, and you will have 3-minute reading time before the consultation. Now, some people may get extra time if they can have a reasonable adjustment that's been approved by the college. It's important that if you do feel like you may need a reasonable adjustment, that you apply as early as possible. It is a case-by-case basis. The simulated consultation assessment, as the name suggests, it's simulation. So it involves professional role players who will mostly be playing the role of patients. However, you might have role players who are playing the role of a district nurse, an advanced nurse practitioner, or a paramedic, or even a social worker. And the ratio of consultation that you will have is likely to be 9 video consultation and 3 telephone consultation. And what's the irony here is that most GP trainees, they don't have much experience of video consultation. So it's important that when you're practicing for your exam, you practice remotely so that you get the hang of consulting over a video consult. Because when you're consulting face to face with a person, it's very different dynamic. So when I'm speaking right now, with looking at the webcam, is different. The energy level is different to if I were in the same room as you and I was giving this talk. So you need to practice that. Normally for um, virtual consulting, you have to increase your energy level a bit more so that you appear that you're more engaging. Whereas if it was in real life, then you won't have to put in that much effort. So the cases are going to be recorded and then reviewed by an examiner and marked at a later date. The physical examination are not going to be assessed in the SCA. So make sure that even if you feel like a patient might need to be examined, if you feel that's important for the assessment, you can mention it, but don't spend too much time on it, because then you're going to be describing a detailed examination where you're not going to get any marks for it. The things that you're allowed to bring for the exam is a paper copy of the BNF and children BNF. You can bring a black whiteboard, which I would suggest, because if you have the ability to bring something, then you can make a note during the exam. So pen on your desk and a whiteboard, and make sure that you familiarize yourself using the whiteboard so that during the exam you don't feel like it's a distraction when you're consulting your patient and using the whiteboard. So you're familiar how you're using it. A tip for you is, if the patient is telling you something, you can tell the patient, let me make a note of this, and then you jot down a couple of things. And that way, the patient will feel more that you're paying attention and you're listening. So the thing that you need to make sure you don't do, though, is keep writing on the whiteboard and not engaging with the patient, because then you're going to lose mark. You can bring a bottle of water. Make sure that you're hydrated during the exam. So let's get to what's the purpose of the SCA. So the SCA is here to ensure that you're able to consult at the level of a safe and independent GP. So examiners are looking whether you can keep patients safe, whether you can adapt yourself in terms of your approach, your management, especially when patients might not be agreeing to a management plan, then you might need to accommodate it. Or they have got a unique circumstance where you need to take that into account when you're formulating your plan. Another big part of this exam is how you manage risk, medical complexity, and uncertainty. So in your practice, you might be dealing with this already. And it's important to look at how the senior colleagues are managing medical complexity and uncertainty, because there is also a pattern recognition that you need to learn that will help you during the exam. Examiners are also assessing whether you're exhibiting the appropriate behaviors, the attitudes, and concern for your patient. Sometimes you might find that the patient has various concern, but if you're a doctor-centered um, uh, in your approach, then you might neglect that concern of the patient and you might dismiss that. Whereas a person-centered approach, the patient's concern become your concern, and you try and solve that concern so that then the patient will be able to listen to what you've got to say and follow any of the recommendation that you might have for them. Whereas if you doctor centered, they might not be open to listen to you because you're telling them what to do instead of listening to them and making suggestion or recommendation that they will be more open to accept. The exam dates have been published, so make sure that you think about which date that you're going to book your exam so that you don't miss the date, because it's very important that you make sure that you reserve first and then you can book it. A lot of people are going to book at the same time and the capacity is limited. So if you're getting a morning session, then you'll be starting at 9 o'clock. It's important that you come early, you get yourself on the system early, because there has been a lot of IT issues, and make sure that you have ensure that the computer is working well. 9 o'clock, you log in on the system, and there will be an ID and environment check. So they'll be checking your environment, see whether there is any notes that you've been keeping or anything that is not allowed. Then at 9:30, the examination starts, and you'll start with the first half of the cases, so cases 1 to 6. And at 11 o'clock, you will have a comfort break. So during the comfort break, then make sure that you relax and don't worry so much about what's happened, because that's not going to help you for the future cases. At 11:10, the examination restarts, and you then complete the 6 remaining cases. And the examination finishes at 12:40. However, if there has been some issues with any of the stations, for example, the connection actually broke down, or if there's any IT glitches, then you may be asked to rerun some of the stations. And at 1:20, the examination ends for everybody. So if you're getting an afternoon session, then you'll be starting at 20 to 2. It's the same process. It's important that you make sure that if you're starting in the afternoon, you don't do something that's going to make you feel stressed in the morning. Keep it very cool, and ideally you should have already booked your professional leave for that, so that everybody in your practice knows that you'll be sitting the exam. You'll be starting first case, and then you'll be going through the first half, and then having this comfort break of 10 minutes. Feel free to stretch yourself and stand up, just so that you don't just sit on your chair for the whole exam, because it can feel very exhausting when you're consulting back to back. The 3 minutes reading time is crucial that you use it. Now, for the exam, you might find that you're getting a lot of information. It's very important that you train yourself to skim read and be able to read quickly. Some of the cases, you might get 2 to 3 pages of information to read. So it's important to train your eyes to read quickly. So a quote I'd like to share with you is by Benjamin Franklin. By failing to prepare, you're preparing to fail. So make sure that you prepare, because this is an exam that you need to take seriously. There are 12 clinical experience groups that you're going to be assessed upon. Make sure that you understand what are the areas of weaknesses that you might have early on, so that you can address them. A common area of weakness is professional and ethical dilemma. This is where GP trainees don't know much how to handle this. So it's important that you make sure that you practice and refine these types of scenarios. For example, if you're having to advise a patient to refrain from driving, but the patient wants to drive and they're not listening, or if, for example, you've got a under 16 who's requesting contraception. So you need to be able to show that you're making a safe assessment, you're considering safeguarding concern. For male GP trainees, commonly they struggle with gender, reproductive, and sexual health. So if that's the case, then make sure that you practice these cases. So in the 3 minutes reading time, you want to prepare your consultation. Read the case briefing carefully. So there are keywords in the case briefing, and if you don't read it carefully, you might misread it, and it can affect what you think is going on. Jot down a few key points. So, for example, red flags, differentials, anticipate what might be coming, play the consultation in your mind, and also consider what are the possible solutions and management plan. So often I've seen GP trainees, when they're priming their cases, they're only thinking about data gathering. They're not thinking about the solution, how to manage the case. So let's have a look at this case. So this patient is being seen by the district nurse, who is quite concerned. And apparently the patient's been having diarrhea. Uh, We're fortunate that we've got the observation from the district nurse. So tell me, what do you think of this case when you're looking at this case? What are the things that's going in your mind? So Manal asks, how do you prepare that for a case that does not show what the case is? In some cases, you might not know what might be happening. That's true. But you can still think about what could be happening, looking at the patient's age, looking at the past medical history. So, for example, here, you might not know what's going on with this patient if you're not giving the briefing. And you need to still have an open mind, because even the information that you're given could be different to the presentation. For example, this patient who will advise that they've been having diarrhea, they might tell you that they're having loin pain, they're struggling to go for urination, and it can actually turn out to be something completely different. So if you don't have an open mind, then you'll be thrown off by something you don't expect in a consultation. So tell me, what do you think are the risk factors in this case? Write in the chat what you think are the risk factors when you're reading this. So look at the past medical history. So you've got somebody who is having diarrhea. They could be at risk of dehydration. There's also risk of AKI here. So things that you might want to consider would be whether they're having any blood in the stool, how much urine are they passing. That's good. Yep. So what you want to do is to train your brain when you're working in your practice before seeing a patient. Have some time and think about the case beforehand. Treat it as if it's your exam, and then you'll train your brain to prime the case. And when you're having all this information, you will know what are the things to consider. Obviously, if you're not told what could be the case presentation, you might not know. But at least if you have an open mind and you keep an eye on what you think might be relevant, then when you're consulting, it's going to be more smooth. So you have 12 minutes to consult. And when you're consulting, it's important that you keep track of your time. If you don't keep track of your time, you might run out of time. And time management is the most common problem that GP trainees have. And they squeeze their clinical management, or they don't even have time to finish. So how is the exam mark? There are three domains for this exam: data gathering and diagnosis, clinical management, and medical complexity relating to others. So data gathering and diagnosis is something that most of you are very familiar with because you've been taking history from medical school. But clinical management is the one that some trainees tend to procrastinate because they don't want to commit to working diagnosis, or they have a fear that they may miss something there, so they dwell on data gathering. So you want to have a balanced consultation where you're consulting, in which you give yourself 6 minutes in data gathering and 6 minutes in clinical management. So you will be awarded a grade, and clear pass is where you demonstrate that you're consulting above the standard of a newly qualified GP. Pass is when it's sufficient. Fail is when you're not demonstrating that there's enough evidence for an independent GP, and clear fail is where you're dangerous. Now, it can be difficult for many trainees to know what is a clear pass and what is a pass. And the exam, in some extent, the examiners is going to be subjective because they are reviewing a lot of cases. And if they have reviewed a case where this GP trainee was very good, very thorough and smooth, and then they are then having to review a case where the GP trainee is a bit clunky, but is still safe. So this is where there's a difference, you see. They will still pass the other GP trainee, but there's a contrast between how smooth they are and how the patient felt at the end of the consultation. So for clear pass is where you're doing going above and beyond for the patient. Whereas for a pass, you're just doing what's enough to pass it. It's still very safe. However, there are some parts of the consultation where there might be some misalignment. Is it clear so far? Because I know some of you might not understand the marking. Okay, so let's move to the next one. So in data gathering, what you're um, looking for is to be able to take a history systematically. This is where structure is important. When you have a structure, then you're not going to take a history where it's disorganized and you're doing things a bit haphazard. So this is where the priming is important. You're thinking about the consultation before you even start. And what you want to do is train yourself to sharpen the quality of your question. Because some question, if you ask them too early, then you're not going to get a good response. For example, if in the first minute you're asking closed question, then you're going to have to work harder to take the history than somebody who's asking a couple of open questions where they are encouraging the patient to tell their story. So don't ask closed question too soon. Make sure that you understand how to balance your question. It's important then to identify what problem you're solving. So if you remember when we started, one of the things was problem solving. If you're solving the wrong problem, you're not going to score points. So you need to know what problem you're solving. And this is where the patient's idea, concern, expectation is important. Because if you don't know what's in their mind, then you might be explaining what you think is the right thing, but they're still worried about something else. So in clinical management and medical complexity, you want to demonstrate that you're formulating a safe and appropriate management plan. And this is where prioritization might be an issue as well. Sometimes you might find that the patient is coming with a problem and you're thinking about various treatments, but you need to know what is good to discuss today and what might be better to leave for the next appointment in a follow-up consult. For example, if you got a patient who's presenting with stroke, you're not going to tell the patient about smoking in the first consult because you want to deal with the acute problem, and then maybe you can arrange a follow-up for the secondary prevention. So you need to prioritize the short term and the long term. So the management needs to be safe and based on current guidelines. In relating to others, this is where it's about your emotional intelligence that plays here. It's not just about how much you know, but how do you interact with the patient? How do you build the relationship and develop rapport with your patient? Doing that remotely is challenging in itself. So you need to know how to use your body language. Sometimes if you're smiling when you're talking, it's actually showing that you're enthusiastic, and you'll make the patient feel more at ease. So this is where it's important to know how to build trust with your patient. So that you want to develop a care where you're personalizing it for the patient instead of just delivering a generic care for your patient. That's why the psychosocial is important, so that you can tailor your plan based on the patient's preference and circumstances. You will also get a mark for the global as well. So globally, the examiner will judge whether they think it's a pass or not. So you might have pass, bare pass, bare fail, and fail. So the pass mark is going to be determined based on the performance of the whole assessment. So everybody's performance is going to be taken into account, and then the pass mark for each of the station is going to be determined. However, for you, when you're doing it, what you want to aim for is that you're aiming for at least 6 points out of 9. For example, let's say if you're getting 3 points for each of the domain. So if you're getting 6 points, then you're in a good position. The clinical management and medical complexity domain is going to carry more weight. However, even the examiner doesn't know how the weighing is. It's all calculated afterwards. So you don't have to worry about it. All you have to do is to make sure that you give yourself enough time to have the clinical management in your consultation. Because if you don't give yourself that time, ideally 6 minutes, then it's difficult then to score well in clinical management. So far, we've talked about the introduction of the SCA. Then the next part, we're going to look at the challenges and pitfalls. Common pitfalls I see is that GP trainees are not ready yet and they're sitting the exam too early. So ideally, what you want to do is you want to have already sat the AKT and then have at least 6 months of experience in general practice. Now, there are people who can still pass it even if they haven't passed AKT or even if they don't have experience. However, the chance of you passing is higher if you've already done your AKT and have at least 6 months experience, because then you will have a better way of consulting, because 6 months of experience is the big difference between an ST3 who's just starting and who's midway in their training in ST3 year. So inadequate preparation is another big one. Sometimes GP trainees, they feel that they'll just cram everything at the end. However, for this exam, this is not where you're cramming things. This is where you need to embed the good consultation skills early in your ST3 years, so that when you're consulting in the exam, then you're not going to revert back to old habits because you have embedded good habits. Time management, we've talked about that. This is a big issue. So make sure that you identify the causes of poor time management. So it could be that you're summarizing too much. Maybe you're not asking selective questions, or it could be that you're not committing to working diagnosis. You're just dwelling in data gathering. Doctor-centered care, lack of confidence is another major issue, or the opposite, which is overconfidence, when a trainee might not even know that they don't know something, so they feel that they can pass this exam. And sometimes it could be because of the feedback they're getting as well. So feedback such as, you're doing well, just keep practicing, which is just useless because you don't know what you're not doing well. So not receiving constructive feedback, struggling to take a targeted history, which has a knock-on effect on clinical management. This is where some trainees struggle with relating to others because they don't know how to be empathic, and they may appear to be cold and insensitive. Not actively listening is another big one, where GP trainees, they're just missing the cues. So what the top scorers do, the high-performing GP trainees do well, is that they're learning from mistakes. So learning not just from their own mistakes, but learning from other people's mistakes so that they save themselves from making the same mistakes. So it's about being able to reverse engineer your consultation based on the feedback statement. So in data gathering and diagnosis, common one is not doing enough to enable a safe assessment. So this is where you need to show that you're making a safe assessment. This is where you're thinking about various questions that will allow you to know what's the problem and making a safe assessment. Another one is not being systematic. So this is where there is a risk that your consultation is disorganized and not functional. That's why you want to embed good practice early on. So differential diagnosis or hypotheses were inadequately generated or tested. Sometimes GP trainees might jump to a diagnosis too soon, so they're not staying open in their differentials. They jump to a differential too soon without considering, for example, if you're taking a history of a patient who's presenting with lower abdominal pain, if it's on the right side, you might think it could be appendicitis, but it could be something else as well. It could be kidney stone, for example. So you need to have a thought process, as in what you're considering. So in clinical management, this is where the management plan is not based on current guidance. So, for example, if um, you're too patient driven in your consultation because the patient is asking for referral or some tests, then you offer this even if it's not needed. Or if the patient just tell you they don't want to be going to hospital, and then you just say, okay, we can treat you at home, but you're not discussing the consequences, and you're not trying to persuade the patient to go to hospital because you're concerned. So that's another problem as well. Then there's prescribing, whether you're prescribing safely and whether you're going by the guidance. Another one is the plan does not really um, show that you're considering the risks adequately. So, for example, you might get a patient who is on warfarin and they're starting to have bleeding. So you need to know how to assess this risk and make a clinical decision, as in where you're showing that you've considered the risk of bleeding and the risk of a stroke as well. For example, if the patient's taking it for AF, then you've made a very balanced decision. So we've touched on time management earlier. I'm not going to go in much more detail on that, but make sure that you keep track of your time. So in relating to others, there are common mistakes as well that you need to be aware of. So first one is problem with the listening. So most of the time, the problem in data gathering is that the GP trainee, they're doing a lot of talking and they're not listening enough. So you want to make sure that the first half of the consultation, you give the patient space to talk and you don't do the talking, and you do more of a listening. And when the patient is dropping cues, pay attention to these cues. If you miss it, they might drop it again a second time. But if you miss it again, they might not drop another cue for you. Make sure that you have ownership of your responsibility. Sometimes GP trainees will not make any decision. They're just there and giving options one after the other, but not giving the professional recommendation, which is what the patient values. So you need to give your patient your professional decision, as in your recommendation, so that they can make an informed decision. Another one is giving patient option that is not good option, and then later having to tell them, I don't think this works, and then going back. So that's not a good use of your time. So if you're giving somebody an option, it needs to be an option that you think would help them. Don't give them option that might not work. And the sequence as well is important. So if you know what's the first line treatment, you start with the first line. Unless the patient has brought up something else to you, then you readdress that and you tell them that this medicine that you're talking about, I can't recommend this because there's not much evidence that it works. So, for example, if they're asking whether they could take St. John's wort for depression. So we've covered challenges and pitfalls. And the next part is how to prepare and pass. So A quote that I like is, "We don't rise to the level of our expectation, we fall to the level of our training." So that's where it's so important that you're preparing early on, because there's quite a lot of work involved for this exam. So you can't just expect that on the day of the exam you will do well. You need to have put in the work from day one. So what high performers do, they plan and prepare early. They have an awareness, and developing the awareness is going to be where you're seeking feedback, you're recording your consultation so that the unknown become known. Fostering a growth mindset is important. If you don't think that you can improve your skills, you can get better, then you'll just stay stagnant. Understanding what examiners are assessing is crucial. If you don't understand what these examiners are looking for, then it's difficult then to score well. Then you want to tailor your revision to address these areas of weakness. And make sure that you're actively seeking feedback and reflect on your learning. So right now, some of you may be consulting at 20 minutes. So you want to get it down to be able to consult within 12 minutes. So that's something that will take time for you to do. When I say consult within 12 minutes, this does not include typing or writing a prescription. This is just a consulting part. So high performers, they embed good consultation practice and develop their own style. So they have embedded this so that it becomes second nature. And when they're under stress or pressure, they're still managing to consult well. So how do you prepare then? There are three levels of change that you need to be aware of. Most people, they focus only on their skill, but they don't look at their attitude. What attitude do you think that the examiners are looking for in a candidate? Write down in the chat what attitude do you think the examiners are looking for. The attitude that the examiners are looking for is somebody who is curious, who genuinely cares about their patient, and somebody who is showing that they have got compassion. Okay, so you want to demonstrate these attitudes, and then the skills that you need to develop a listening skill. Being able to listen is really important for this exam. You want to be able to negotiate, so negotiation skill, and there are other skills as well that you need to practice. For example, signposting as well is really important one. How you make sure that you navigate the consultation, especially when it becomes very challenging. How you manage complexity, how you manage uncertainty. So the skills are things that you need to develop by practicing and refining. And then the behavior is what the examiners are going to observe. This is what the examiners can see, what they can hear. So if somebody is got a negative attitude, but their consultation skill are very high, do you think that they're going to score well? What do you think? So if somebody's got poor attitude and then consulting very high level of skill, then they're probably going to score low. However, if you've got both high, you've got positive attitude, you show that you're caring, and your skill is really good as well, then you're going to score much higher. Now, just being nice is not good enough though. Some people might feel like, oh, if you're just nice to the patient, you'll score. But that's not enough though. So you want to have all of it. You want to have positive attitude, great attitude. You want to show that you're competent, and then you're able to develop that and show that by the behaviors as well. When you have that, you'll have an alignment. Um, where your attitude, your skill, and behavior are in coherence. And this is when you're more likely to score well. So being strategic is crucial, because if you're not strategic, you're going to spend a lot of time working hard, practicing and practicing, but not making any progress. Okay. So how do you prepare that? Decide which sitting you're going to go for, reserve your space, make sure that you're planning at least 6 months before the exam. Identify your blind spots. What are your areas of weakness? Give yourself ample time to embed consultation skills, seek regular feedback, and make sure that you keep adjusting your consultation. So recording is a big one. This is really powerful and underutilized. Many GP trainees don't like to record the consultation because it's just not pleasant to watch yourself back and listen back. However, if you don't do this, you're missing a big part of the opportunity to progress your consultation. So make sure you record at least one consultation a week. You don't have to show your supervisor if you don't want to, but for yourself to look at how you're consulting. If it's a good one, you can use it for a cut, and you're killing two birds with a stone. So you need to do the cut anyway. So record some cases, and that's going to help you for your portfolio and also for your exam. Join a study group. Study group are really helpful. It depends on the quality of the group, though. Sometimes some study groups might not be very helpful, where there's people arguing, or you're just doing one case and you're observing most of them. So it's important that you join a study group where there's a good dynamic in the group, where you're learning a lot and you're challenging each other, you're giving each other giving constructive feedback. Ideally, if everybody is sitting the exam in the same month, then all of you are going to work together towards that goal. Whereas if you've got a group where some people are sitting it in April, other people are sitting it in January, then the level of motivation is not going to be the same. Um, Joint consultation is a good method of learning consultation. Um, it's quite useful to see how a senior GP is consulting, because then you will learn how they are thinking and how they manage uncertainty and complexity. Um, Developing your management skill at complexity is very important. In the exam, you'll find that there's complex cases, and you don't want to feel overwhelmed by these cases. So having a framework is really important. This is a framework that I've developed. Now, the way it works is that in the first minute, you want to listen actively to the patient. This is the golden minute. And the simulator has got an opening statement and a storyline. You want to encourage that, so that you're not having to ask a lot of questions to get that information. So you want to ask an open question to get them going. If you have an angry patient, you want to let them to vent off their anger in the first minute. Let them talk and talk, because once they vent off their anger, then they'll be more calm and you can progress the consultation. But if you interrupt them, you're just going to make them more angry, and it's going to escalate. So once you've got the story, the next step is to get the patient's idea, concern, expectation. Then you can ask about the biomedical, and thinking about your red flags, so that you can come to working diagnosis. After you've done that, you want to understand how is this impacting your patient, and also you want to understand the person as well, not just the disease, but we're treating persons who have got a life. They might have other people around them. So we want to know a bit more, so that when we make a plan, then we can take into account their situation. At 6 minutes, ideally, you should have all the information you want, you need to actually move the consultation. So then you readdress the patient's ideas, concern, expectation, and then you develop your shared decision with your patient, making a plan with the patient as opposed to for them. So, for example, let's say a patient is thinking that they've got chronic fatigue syndrome, but you don't think that's the case. You think that maybe they have put on a bit of weight and they've got sleep apnea, for example. Then you readdress that. You can tell the patient, I know that you feel you might have chronic fatigue syndrome. Having listened to you today, I think that chronic fatigue syndrome is not the diagnosis I'm thinking here, because you told me you put on weight and you're finding it difficult to actually go to work, and you've been sleeping behind the wheel as well. What I think you've got here is uh, sleep apnea. Have you heard of? So you see how you can readdress the patient's eyes and then explain what you're thinking. So then you can discuss about how this manage. Also make sure if they've got sleep apnea with daytime sleepiness, to advise them to refrain from driving. Because if you don't do that, then you're not going to pass the station. So then think about a referral if needed, and explain what is going to happen afterwards. And then make sure that you arrange your follow-up. If you need any safety net, make sure that it's appropriate to the context of the case. Okay, so PSO stand for psychosocial situation in occupation. Right, let's do this case together. Linda is a 50-year-old woman and should like to go an HRT. What do you think you might need to ask Linda in this case? If you have this case for your exam, how are you going to approach this case? Yeah, we've got good suggestion here. So you want to inquire about um, the symptoms that she's having, gynae history, when was her last menstrual period, explore the idea here, the concern, expectation, what's the reason she's asking for HRT now. You want to also consider whether she's suitable to have HRT, um, because there's various questions that you need to ask to understand whether there is any contraindication or not. And you want to check about the psychosocial the situation and occupation as well. So when you're doing this case, it's important that you're considering a differential diagnosis as well, whether it could be problems with the thyroid, um, not that common pheochromocytoma as well. Consider the contraindications, and also you might want to consider whether this patient might need to have contraception or not, because that would affect the management. Um, so in terms of the management, then the management here, we also need to know what she's tried before. Sometimes some women try over-the-counter products. Um, we also can have lifestyle modification as well with the HRT. Discussion of the risks and benefits and the adverse effect of HRT is important in this case. So you need to know what are the HRT that you're going to prescribe and how to prescribe it as well. And don't forget to arrange a follow-up as well. So if you had to prescribe HRT for this patient, which one would you go for? Okay, I'm seeing some saying Everal Conti, some saying LSLO. Okay, right. So it's important to understand whether this woman has got a uterus or she's not got any uterus. Because then that would mean that you might need to prescribe a combination or you're prescribing only estrogen. Another question is whether this woman is perimenopausal or postmenopausal. When was her last menstrual period? If she is perimenopausal, then usually you would prescribe the HRT cyclical. So this is a sequential combined therapy. And if you're going for oral, then it's LS duet. Um, Otherwise, transdermal, you could prescribe Everol Seki patch. Now, if the woman is postmenopausal, then usually you'll go for a continuous combined one. So oral would be Cleofem. Transdermal, you could prescribe Everol Conti patch. So a question I've got for you is, does practice make perfect? So a lot of time I hear registrars say that practice makes perfect. Practice does make perfect, however, it's not entirely true. If you're practicing doing the same thing without getting feedback, without being aware that you're doing something incorrectly, then if you keep practicing that, then you're not going to do well. So it's important that you don't do the same thing and expect to have a different result. Okay, let me share with you a case study. So this is Dr. Inamuna Berega. He is an IMG. He was stuck in his training for years. He failed the MRCGP SCA 4 times. And I can tell you, he was practicing. It's not that he was not working hard. He was practicing, he was putting in the work. However, he failed his exam 4 times. And this had a significant consequence on not just his training being delayed, but also on his emotional and personal life. He also had depression, and this affected his personal life as well. So, question for you. What do you think is a pass rate among IMGs for the clinical component of the MRCGP exam? Okay, some people are saying A or B, right? So, if you're an IMG, if you were sitting the CSA, the pass rate was very low. With the RCA, it has increased um, to just beneath 50. So it's around 49%. Now, we don't know what's going to be for the SCA. I think for the RCA, it has improved because candidates had the luxury of cherry picking which cases they could submit. And also, the time of the consultation has increased to 12 minutes. So it will be interesting to see what it is for the new SC exam. But as an IMG, the pass rate is lower compared to a UK graduate. So it's harder for an IMG. So the consequences for Dr. Inamuna Berega was that he spent over 5 grand on exam fees. His confidence was deflated at rock bottom, and his career was on the line. So normally you have only 4 attempts at the exam, but exceptionally he was given a fifth attempt. And another big hidden cost here is that he had completed his training and was working as a GP, he would have been earning uh, at least 100 grand if he was working as a GP. And that's delayed because of the exam. And he's lost at least 50 grand just because of having to extend his training. And that's a loss that a lot of people don't realize when they're stuck in training. So he was going through a very negative cycle of vicious failure after failure. And because he's been trying doing things and it's not working, he realized that he had to change something. Because if you keep practicing and practicing and you're not getting the right results, you have to ask yourself whether there's something not working. And luckily, he decided that he had to change things. And instead of just practicing and practicing, he was following this cycle now, where he consults, he assesses his consultation, seek constructive feedback, make adjustment, and implement. And by going through this positive cycle of uh, refining his consultation, he managed to get better. And a key part of that was getting feedback so that he got awareness of what he was not doing right and what he had to change to be able to pass his exam. And his efforts paid off. He passed all of his stations and scored 164 points in his fifth attempt. So I'm sharing this because some of you might feel a bit desperate if you haven't passed your previous exam. And this is a prime example of somebody who's changed his approach and managed to pass his exam. And he's now working in the north of England. So this was a picture we took together. So is it okay if I share with you some resources that you can use for your exam now? This is consultation blueprint system that I've developed after working with trainees, trainers, and examiners. And this is really important if you're following a blueprint, because you don't want to do things and hoping for the best. You want to follow a proven blueprint so that you actually making sure that you're progressing your consultation and embedding good consultation skill. Today, I will share with you the SCA Companion. This is a system that is a plug and play system that you can use. It's in a Google Sheet where you can keep track of your progress and monitor your areas of weaknesses and use that so that you're informing your study sessions. A lot of GP trainees, when they're planning study session, they're just going through cases by the books and they are not intentional. But if you use a companion, you will understand what are your areas of weakness and what do you need to focus in your study session. So when you have these goals, then you will progress much faster than somebody who's just doing cases and not being intentional. Another benefit is that when you're recording the cases that you're doing on the companion, then you will have a body of evidence to show you what are the learning points, what are the feedback you receive, so that you can see where you need to put in more effort. And also it will build your confidence when you're seeing your progress. So I will send you an email where you can access that after this webinar today. So this is the tabs that you will see on it, where you're keeping track of what you are doing and the steps. And this is the 12 clinical experience groups. Then there's also the consultation blueprint. This is a program that I have set up to help GP trainees who want to go further in their preparation. So if you found the webinar educational so far, then you might be interested in this program where I go in much more detail than we could go over in 1 hour today. So there's lessons about how you can consult, where you're refining your consultation skills, and how you address the challenging cases, medical complexity, and how to manage uncertainty. And you'll be joining a thriving community for support and accountability. So there's case demonstrations with simulators that map on the 12 clinical experience groups. A quote from Confucius is, "I hear and I forget, I see and I remember, I do and I understand." So this is where it's important that you're doing things where you're learning by immersion. And on the 16th of December, I'm going to run another workshop in which you will get a chance to practice if you attend and get feedback from myself. There will be role players where you can practice very challenging cases. This is what a GP trainee said after attending it. Very difficult case, practicing it with friends just does not do the case justice. Rachel is one of a simulator. She's really good. So this is another GP trainee who joined the program, and she was stuck in her training. Her name is Sana Khan, and after joining the program, we look at her consultation and change her approach, and she managed to pass her exam despite having crippling anxiety. She's now working as a GP and also do some shift in A&E. You probably remember Dr. Inamuna. So this is what he said after joining the program and passing his exam. His confidence was boosted after the sessions. So we've got over 65 testimonials. These are just 3 of them that I'm showing you today. If you would like to have further support, I've also opened a few spaces for one-to-one coaching. Some people, I understand, don't want to practice in groups where they want more personalized coaching. And you get everything that we've discussed today, including the case demonstration and invite to the immersive workshop when you join the one-to-one. You also get a strategy session where we're personalizing your preparation, and you will get constructive feedback and personalized support so that you're guided every step in your preparation. So you will also get the free one-to-one coaching with myself, and this is scheduled at our mutual convenience. So the normal price for this package is £1,199. But if you book, you can get it for £995. So this is the one-to-one coaching program. I only coach a very select number of GP trainees because of other commitment. There's also our support group. If you have not joined, you can join our Facebook support group. I post regularly on that, where you can get practical tips with your preparation. I want to leave you with 3 actionable tips for today. So make sure that you're recording and analyzing your consultation regularly. Seek constructive feedback frequently. It's important that you're getting feedback because you might not know what you don't know, and you might think that you're doing well, but without the constructive feedback, then this is where you're missing a big part in your progress. And that's where I've noticed among GP trainees who struggle with the exam. Last bit is to reflect on your learning and make sure that you're adjusting what needs to be changed, and that way you keep refining your consultation. So today we've gone over introduction of the SCA, the challenges and pitfall, how to prepare and pass, and I wish you best of luck with your exam. If you've got any questions, feel free to ask me any question. I'll still be here for the next 2 minutes.